You're watching Canadian Muslim News on Muslim Network TV from Toronto, Ontario. I'm Samia Sayed. Welcome to the show. Joining us later is Dr. ZAINAB FURQAN to tell us more on how health providers can address Islamophobia through trauma-informed framework. But first, let's take a look at the headlines. Quebec's town to keep their bilingual status. 2 families file complaint for being targeted by Palliser School Division. Seerah exhibition to showcase holy artifacts. EU representatives visit Gaza to show support amid Israeli airstrikes. And now the details. The Quebec government will soon revoke the bilingual status of any municipality whose English language population is less than 50%. The municipalities can opt to keep their status by passing a resolution within 21 days of receiving the notice of revocation. Scott Pierce, the bilingual municipalities representatives at the province's Federation of Towns and Cities, says, according to local media, that the sitting government has given the towns an easy solution to retain their status. Pierce says most of the mayors of the towns with bilingual status plan on formalizing it. There are about 90 municipalities in Quebec with bilingual status. This revocation is a result of Quebec's new French language law, Bill 96. 2 Muslim families allege being unfairly treated by the administration of the Calgary Islamic School, Palliser School Division, and Muslim Community Foundation in Calgary for publicly announcing a fee dispute last year. They are filing complaints to Alberta's Human Rights Commission. According to the families, the fee dispute was resolved, and despite paying the amount, the children of the 2 families were refused admission for the coming academic year. Then, in the first week of August, the families received letters from the board allowing the children admissions for this year only. Both families say that they will not allow this situation to go unaddressed. An event titled Seerah, Prophet Muhammad, peace be upon him, his legacy and artifacts is being held in Mississauga's International Centre, Ontario from September 23rd to 25th. The one-of-its-kind exhibition includes visual and audio enhancements that showcase different elements of the Holy Prophet's legacy. There will be 22 exhibits, of which 9 are dedicated to showcasing distinct holy artifacts such as the Prophet's hair and beard, sandal, footprint, and walking cane. These artifacts will help visitors learn about the life of Prophet Muhammad, peace be upon him, and the Arabian culture at that time. The event is organized by a Malay Muslim Canadian organization known as Dunya Melayu, Dunya Islam. Representatives from the member states of the European Union are visiting the Gaza Strip today to observe the humanitarian situation after the latest Israeli airstrikes. Sven Kuhin von Bergsdorf, the European Union's head of delegation in West Bank and Gaza, says the visit is meant to demonstrate the European Union's commitment to fight for the just cause of the Palestinians. In a joint conference with the United Nations Relief and Works Agency, Bergsdorf said that the signing of a contract of 97 million euros for this year will allow UNRWA to take forward their tremendously important education efforts. Israeli warplanes launched airstrikes against targets in Gaza on August 5th, killing at least 49 Palestinians, including 17 children and 4 women. That's it for the news. Now, Islamophobic attacks have sent shockwaves throughout many communities, including the medical one. But how exactly does Islamophobia manifest in the medical sector, and what can health providers do to address it? Dr. ZAINAB FURQAN, a clinician investigator at the University Health Network and author of the Canadian Medical Association Journal article, Understanding and Addressing Islamophobia Through Trauma-Informed Care, is joining us now to speak more on this topic. Welcome to the show, Dr. FURQAN. It's great to have you join us today.
Thank you so much for having me. It's wonderful to be here.
Likewise. Dr. FURQAN, can you summarize some of the key points from your article for us?
Of course. So I just wanted to start off by saying the article itself was inspired by the horrible events that happened in London last summer, where we lost tragically a beautiful Muslim family, members of a beautiful Muslim family. The Muslim community was quite shocked by this, and our team was quite concerned about how little discussion or knowledge there was about Islamophobia in medical settings. So we decided to use this as a launching point to raise awareness about the lethality of anti-Muslim discrimination in Canada and to give healthcare providers some practical tips about what to do. We start off in the article by explaining what the health ramifications of Islamophobia can be. So first of all, there's a psychological distress associated with Islamophobia. When there are traumatic events like the London killings or the Quebec mosque massacre, the entire community can often be in a state of fear, hypervigilance, grief, psychological distress, and that can be very challenging to deal with. So there's a psychological distress, but then there are also physical health ramifications as well. There was some initial data in the US that even showed things like blood pressure and other health markers could be affected by traumatic events like this, and discrimination experience more generally.
Is this
And
the
then
trauma-informed framework then you're speaking about?
this is first just the background. So I think this is first about educating people about the nature of Islamophobia and its consequences. Then we actually get into the trauma-informed framework. The last piece I just wanted to mention was that I think if people are expecting discrimination in healthcare settings, patients are less likely to come to healthcare providers with their concerns. So that's another way that Islamophobia can negatively impact people's health experiences. So now the trauma-informed framework itself, it's a way of structuring our care as healthcare providers to make everyone feel safe and comfortable when they come to us. So this was originally, the framework was developed for all forms of trauma. So we try to make it more specific to Islamophobia.
And I saw that there was specifically 3 areas or methods highlighted to show different ways in which health professionals can make use of the framework. Can you tell us some of those?
Of course, yeah. So this framework can be applied at many levels, institutional and personal. So this is specifically about the interaction between doctor and patient. The first thing that physicians can do is create a sense of cultural safety. And that starts by examining our own biases, our own presumptions. So many of us might also be carrying stereotypes or discriminatory ideas that may be Islamophobic in nature. For example, a physician might ask, I have observed this, asked a patient whether or not she was being forced to wear hijab by her male family member. So this is really coming from a stereotype or bias that assumes Muslim women are oppressed and forced into doing things, and Muslim men are violent and domineering. So the first thing for cultural safety is healthcare providers reflecting within themselves and trying to understand where some of their assumptions and biases are coming from, and then seeking out the appropriate knowledge to fill those gaps. Healthcare providers should also be aware of basic practices that can impact health. For example, a vast majority of Muslims fast during Ramadan, and that has significant health implications. So this is something that healthcare providers can be knowledgeable about and can also contribute to creating a sense of cultural safety. So that's number one. Number two is that when big events like this happen that are traumatic for entire communities, I think it is helpful for healthcare providers to check in with their patients to see how they're coping. For example, myself as a psychiatrist, I see people with depression, anxiety, and many of them Muslim patients talked about having those symptoms worsen, having sleep difficulties or anxiety being raised in the aftermath of these events. So it is important to check in. Of course, it's going to vary from setting to setting. Not everyone will have an appointment where the healthcare provider needs to check in about this, but especially when it's around mental health or family physicians appointments, this can be an important area to check in about how people are doing after events like this. And then the third piece is that culturally congruent. So that means services that are catered to Muslim populations can be very helpful for some people. So healthcare providers, if they're aware of some of the local resources and culturally specific services that are out there for Muslim populations, that can be helpful knowledge to have to share with patients if needed.
Mm-hmm. So I've noticed then from what you've just mentioned that your paper is not only about trauma-informed care, but you also address a lot of the gendered Islamophobia, or even tackling a little bit of the mental health aspect more than physical in your paper.
Yeah, I think it's definitely a lot of different topics that come through that we try to tie together. Gendered Islamophobia is a major point that we wanted to make. Unfortunately, Muslim women bear the brunt of Islamophobia because they're so visible. And it is particularly important for all of us, Muslim and non-Muslim healthcare providers, to understand the complexities of gendered Islamophobia. With regards to psychological and physical health, I always remind people that I think those things are very much tied together. But yes, there can be a particularly distressing psychological aspect of Islamophobia when it is experienced directly or when it is experienced communally. It can really impact our mental health and well-being. And so it is important for healthcare providers to be aware of that and to check in to see if any support is needed.
Mm-hmm. From everything you've just said, I can already imagine the impact that you've made with this research. What was some of the feedback or even responses that you got after publishing the article?
That's a great question. Overall, it was overwhelmingly positive. I think healthcare providers are really eager to educate themselves. I have had so many colleagues, physician colleagues, nursing colleagues, ask for resources. They're interested in learning and they're so open to changing their own assumptions and behaviors if it is going to be helpful for their patients. The other piece is that it's always helpful to tie knowledge with action. So the first part of the article focused more on knowledge, and then the second part was about practical strategies that people can actually implement. So I think there was appreciation for sort of the practical aspect of it. I always do remind people not to oversimplify it too much. A lot of changes do need to happen at a structural level. Entire organizations and governments need to respond to this. But healthcare providers were eager to know, what can I do in my office that's going to make a difference? So that's where these suggestions came from.
Mm-hmm. And I love that more individualized approach. When I was reading over the article and the 3 suggestions, I couldn't help but thinking that it was almost common behavior that I would expect a doctor should exhibit as a healthcare provider. So putting it on paper to me seemed just a little bit very obvious and saying, here you go, please follow this. Is this the case? I mean, do we need to make it so obvious for people to say, this is the framework that you have to follow to actually provide proper health care?
It's a really great question that, some of these suggestions might seem like basic good care. And I think the important thing to remember is healthcare providers, like many other individuals, have sources of conscious and unconscious bias that they may not be aware of, right? And so all of us carry what we call implicit biases. We're always influenced by the environment around us. And given how much Islamophobia is out there, sometimes we might not even recognize some of our actions and behaviors as potentially Islamophobic or further marginalizing this population. So it's about tying the principles of good medical care, but really articulating about some of the unconscious or implicit sources of bias that we might have and how we can bring in those general principles of good medical care to make sure we're not perpetuating those harmful stereotypes.
Mm-hmm. Well, thank you so much, Dr. FURQAN, for joining us and telling us more about your article. It was a pleasure to have you on the show.
Thank you so much for having me. Assalamu alaikum.
Walaikum salam. You were watching Canadian Muslim News on Muslim Network TV. That's it from our Toronto studios tonight. Make sure to like, share, and subscribe to our channel for more Canadian Muslim content. Stay safe, and until next time.